health includes our emotional, psychological, and social well-being. It determines how we think, feel, and act, and affects how we handle stress, relate to others, and make choices. If you experience mental health problems, your thinking, mood, and behavior could be affected by biological factors or life experiences like trauma or abuse. Depression is one of the most common mental health disorders.
Well, depression is not what people think it is. A lot of the times people think, okay, it's just feeling sad from time to time, which happens to everybody. Life throws different challenges at us. Sometimes you'll feel down for a day or two, but major depressive disorder, as we refer to it in mental health, is more than just feeling down for a day or two. It involves sustained depressed mood for 3 to 4 days a week at least, for a period of at least 2 weeks, and it's often associated with a loss of pleasure in activities that were once pleasurable. Difficulties with sleep. Most commonly, people have insomnia, where they're unable to sleep and sleep restfully. Some persons sleep more than usual, but that is less common.
Dr. Brathwaite Drummond spends a lot of her time working in the community. She told us that the causes of depression vary.
For some persons, it may involve psychological factors, significant loss, grief, or other stress-related factors. There's social factors. We know that what we consider psychosocial stressors, so basically difficult things that happen socially. For some persons, it is job loss, financial stress from other aspects. Those are things that can definitely contribute to depression. In women as well, postpartum, having had a baby, there is often, in some women, an element of depression that arises after the birth of a baby.
People with mental health problems can get better, and many recover completely. But the first step is to recognize that you have a problem.
Sometimes a person themselves may not realize, but relatives or friends, as I said, may notice that the person is not functioning as they normally do. A partner may notice that the person is not sleeping as well. A boss may notice that the person's function at work, whether punctuality, the way that they're actually able to produce at work, their productivity is low. So the first thing is to recognize that there is actually something wrong, and to talk about it. That is one of the major shortcomings in our society, that when it comes to areas of mental health, aspects of mental health, we tend to clam up, we don't talk. So the first thing then would be to talk about it after recognizing that something is wrong.
And there can be many triggers for depression. For Katon, it was grief and her love life.
There was a while back that I realized I used to do a lot of crying for no reason. Because before that I was actually diagnosed with the condition. I would always be crying, I would be sad. I would just lay down in my bed. Because looking back now I realized that these things, I used to actually experience these things, but I didn't know why. But then I had a death in my family. And that is what then triggered it. And I was hospitalized. I was hospitalized twice during that time. I also went as far as attempting suicide. And then, I went on medication and everything, and then I came back good. And then something else with the trigger. Then in 2008, another bad love experience. And I went back down again. 2014, another bad love experience. And it was always love that triggered me.
In our next program, hear more from Katon as she tells us how she manages depression, and meet John, who is also living with this illness. Thanks for watching, and goodbye.